Cumberland County EMS, Cape Fear Valley Health System. We think we're the team to beat. We have a great competitive edge. We're ability to adapt. There's a lot of good teams here, so we'll see how it goes.
We got this.
Hi, AJ Heitman here, the editor-in-chief of JEMS, along with Chris Brainerd. Chris, how you doing today?
Good, thank you very much. And after retiring from San Diego Fire Rescue, I'm enjoying being a JEMS judge again. Thank you.
It's great. Only 3 decades with San Diego Fire, so you have a little bit of experience to bring to the JEMS games. The scenario that we're going to see now is being run by Cumberland County EMS of Cape Fear Valley Health in North Carolina. They were the first place finishers last year, and they come in here really wanting to take this competition. It's very tough when you get down to the final 3, right?
Exactly. And what as you're seeing right now on the screen is the helicopter. They're actually outside. They've been sequestered sometimes for hours so that they can't see any of the build that we do for several hours. They're brought to the outside. They're looking at a television monitor where they actually see a helicopter. It's a recorded news feed of a helicopter crashing into a neighborhood. Then they're allowed into the auditorium. They're met by an incident commander at a remote incident command post. They're given a very brief amount of information, and then they can obviously ask for resources. That's what you see here. The incident commander and the lead for Cumberland County. They're exchanging information. What we're looking for at this point is they should be asking about what resources are on scene, what's available to me, and then they should order resources. I need 3 rescues, I need 7 helicopters, I need whatever, just from what they're seeing from 100 yards away.
And what I like about this particular scene is the intensity on the face of all 3 team members. They are scanning that entire scene independent of each other. I could see her counting the number of patients that she can see to get as much information as they can ahead of time. And usually on the way to a call, that's what we get from the dispatch center, whatever information the police, fire, EMS can give to us. And then once they get up on stage, this team from Cumberland is exceptional, as are all the teams, and delegation of who's responsible for what. As soon as they find a patient, they do their initial scene safety scan, check them with the firefighter to make sure that everything's safe, and starting to determine which patients are conscious, alert, not alert. And they don't all stop. You know, sometimes at a scene all 3 will stop, but they don't all stop. They go on to find other victims.
They are only allowed to carry in a certain amount of equipment. Most of the time you see it in the backpack. Cumberland tends to use a larger fanny pack if they keep some of their more personal supplies that they know they're going to use from patient to patient. One of the things that has been common is you'll see them move patients to a common location. Now this is the pilot. We have devastating injuries to the pilot. None of them are survivable. They should quickly assess this patient is deceased. No potential for life save here, and black tag the patient and move on.
All right, go.
And you notice the team leader's wearing a smart triage pack, and a lot of these teams use triage tags. They should, and very quickly decide that this patient isn't survivable, because if they spend too much time on a patient who's not survivable, they ultimately can't do as much as they can. And the innovative tactical training solutions helicopter is just a great prop for us. It was a great addition to the JEMS games this year. We really appreciated it, and it's designed for this level of training, which was really nice for the audience as well as for us.
And you notice that they can see certain patients, but in this case, that's a hazardous area. They are not allowed to go to that patient with a pole across his pelvis. That's time sequence when we will release the safetiness of that particular area of the stage for them to actually go assess the patient.
And there's some teams that'll spend time arguing with the firefighter. I need to get out, I need to assess him. But the reality is, when he tells you it's not safe, you got to just move on. In your mind, whatever happens to that patient isn't your fault. You just have to move on.
The clutter that you see on the stage is obviously props. We actually, AJ, sent burned clothing from the West Coast in his luggage to get it back there so we could have burned clothing, shoes, shirts, pants, to try to make it more realistic. We have some pallets, suitcases. We try to simulate what might have occurred if a aircraft actually went down in a neighborhood. There's even some yellow helicopter blades that we made up with the JEMS logo on it.
And just imagine my wife coming home from work and then seeing the barbecue grill with clothing burning inside of it. So she thought I totally lost my mind, but I lost that about 30, 40 years ago.
And you notice on the screen above the rescuers, one is a video of exactly what the audience is seeing. And then on the left-hand side of your screen, there's vital signs and EKG representation. And that's what is seen on the paramedics monitor. Laerdal picks that information up and then it's transmitted up onto the screen so the audience can see exactly what the paramedics are evaluating.
And I want to comment about this team member that's working on the patient that has the crushed pelvis, because she really was animated and wanting to take care of that pelvis. She picked up on that real quick. At one point, she even leans over to get some clothing that she finds near the scene to improvise a pelvic splint, which is really innovative. You know, it was like MacGyver's sister showed up on the scene. A real credit to this team. And you know, they come back every year, and I look forward to seeing them. I look forward to seeing all the teams, but they're just hard workers. And you notice some of these teams, to the credit of you know, some of them use stat packs, some use merit packs, but they all have their favorite packs, and they really design those packs to be able to find everything. You notice that nothing is hidden under anything else. Here again, they pull out a Escort Junior suction unit. Everybody has a little bit of something different, but one of the things you notice that's a high point for anybody who's watching this is you have to have suction with you when you show up at a bad call. You can't go on the 3rd floor in an apartment building where there's 6 kids that are overcome by carbon monoxide poisoning and then run back out to the ambulance. It's just not going to happen. So suction extremely important in the JEMS games, and all of these teams know that they have to have it.
And here you have a baby. This baby was not made available to the rescuers until the 4-minute mark. It was actually under the stage. One of the judges in picks the baby up, makes it available. Hopefully somebody will continue to update their, size up their survey of the scene, find the baby, and then begin treatment. Time is of the essence. The baby will actually have vital signs that will change in accordance with the time sequence that we've programmed into the Laerdal machines.
And using the SIM baby is a tremendous training resource. You see the umbilical cord that basically comes out of the base of the child, and that can simulate breathing and moaning and groaning and crying and all of the vital signs. It's a really important training aspect, so we're so glad to have Laerdal help us with this. Even the IV starts so much different than it was when we first started the JEMS games, so much more realistic.
And if you haven't used one of these mannequins before, you can actually insert an IV catheter. You can see some of the fluid leaking out, which is what happens in a real patient. If you hit the vein appropriately, you'll actually get a pink flash indicating that you do actually have the cannula inside the vein. That's a positive indicator. If you don't, then you won't get a flash, and the judge will note that you missed the IV and you'll have to try again.
And I think part of the stress we've talked about in some of the other scenarios is that, you know, you're working a call in the middle of an intersection somewhere, and here you're on a stage with 600 people looking at you, critiquing, watching for you to make mistakes, and a true competitor doesn't even care about that. You don't even know what's going around you. You just want to have it. You saw that orange bag there, and that's an orange bag that has fluids, catheters, tape, everything there. So again, these crews have learned, and they could pass on to their crews back home that, geez, you know, at the JEMS games we saw this really cool pack, and they had all of their goodies all in one particular location rather than us having it spread out in our kit. We sometimes get complacent about handling one patient, and all of a sudden we have 5. Don't you agree?
I couldn't agree more. And as this team is doing what I would consider to be appropriately, is they're moving the patients to one location so that they can effectively share equipment. All the equipment they brought is on their hips or in their hands. They don't have a whole ambulance that they can use. And speaking of an ambulance, you may think multi-patient scene, why are we starting IVs? Because we don't make transport available to them until 13 minutes. They have no choice but to continue to treat, which is what we want them to do.
And we want them to give as much care as possible. Again, notice the little plastic container there. He has everything he needs for pain medication right there. It's not spread out into 15 different locations in his kit. He just reaches in, he grabs it, and he takes care of it. And you could see in these films all of our judges with the vests on, and they all have specific tasks. They're all ready when she asks, is the patient still breathing? Is the patient got any other kind of a level of responsiveness? And, you know, one of the things that, to their credit, that I noticed on the skill sheets that were filled out after this is that every one of the teams got a Glasgow Coma Scale on these patients, which I've seen crews day to day forget a Glasgow Coma Scale. And here you're in a situation with 6 patients, and all 6 patients are given a GCS.
These mannequins, they have sometimes 1, 2 times, sometimes even a 3rd set of vital signs, so that when you give a medication, they push a button and the mannequin changes appropriately. If you don't give that medication, then you don't get the same result. So these mannequins are incredibly sophisticated. Here they're trying to intubate. The patient may actually have programmed into the sequence that they're going to clench. They might have to give a medication to relax the patient. For example, a head injury. It's incredible, the sophistication. You just heard a judge yell out a time frame, happen to be 9 minutes, and you see a firefighter. That's not a new kind of dance for EMS. That's actually a firefighter trying to get away from a bunch of bees. And very shortly, she's going to go down because she has an allergy to bees. She goes into anaphylactic shock. And now this other person, you're going to see introduce a mannequin. The reason is that we want them to be able to start IVs, give medications, intubate the airway if necessary, and we don't do that on our volunteers. As much as we'd like to, we have to limit that to the mannequins.
And one of the big pluses about the JEMS games that I don't think you can get anywhere else is so much assessment. There's so many assessment tips that you can learn by coming to the JEMS games. And I've had people come up to me afterwards saying, wow, the way they rattle off and do their palpatory and their sensory assessment is just amazing. And I think that's our whole goal. I know from all of the sponsors involved, particularly from us at JEMS and all of the judges, is we want people to learn things in here and take it back to their systems.
And I'm just going to guess, if you're watching this video, you want to somehow make your service or your skills better. And I applaud you for that. I certainly learn every single year new tricks of the trade. And in this particular case, look at the packs. Is that a pack that you have? Can you learn something about how to organize your equipment? The type of equipment that you use, the type of suction unit, this little mini escort here. Other teams use different types of suction units. In this particular case, I'd really rather see the team use a pediatric bag on the valve and mask. It's too large, it's too easy to overinflate the lungs. So that's one of the critical points we want to drill down on.
And not only is this stressful for the teams, but it's also stressful for the judges. We have judges that come back year after year. We had judges this year that came over from Australia just to help us, just because they love being a part of the JEMS games. And then they go back to their Australian games and bring tips and techniques back there to be able to run theirs. We have several teams out of the 26 this year that had their own mini competitions in their own backyard. So I would encourage anybody who's watching this to get a couple teams together, even if it's just in your particular station, to practice it, and maybe send a team to the JEMS games this year.
Now here at the 11-minute mark, we have a yearly favorite. That's the Fran clan. Fran is our resident paramedic, fantastic instructor. He's with us every single year. And he is an incredible distraction. It's not his size, it's actually his personality. We insert him in to cause chaos. We insert him in to cause drama, and he is outstanding. So he will bring his family, and as they're going to the house, because their house has just been hit by a helicopter, one of his family members falls and gets a nasty fracture to her right forearm. And there's screaming, there's, hey, you're not paying attention to my family members. And Fran is trying to demand that things are happening, and he does it in his own unique way. So does that ever happen on your scene? I'm going to guess that it does.
And it's not just educational, but it's humorous, because you never know what's going to come out of that mouth, do you?
No. One of the things you might be thinking about, how would I handle this? I'm busy with multiple patients. I've got more patients than I've got paramedics or EMTs. How do I handle Fran? Hopefully somebody is saying, let's get law enforcement, let's get some type of security, let's help increase the security of my scene. And some teams do that, some teams don't.
Now, notice there, even the securing of that, using it looked like a nasal cannula that was wrapped around the endotracheal tube of the small child. You still have to secure that tube, particularly when it's an uncuffed tube going into a little child like that. You have to be able to do it. And they're giving her some fentanyl. They're giving it via the MAD mucosal atomization device, which is in great favor around the country, and taking care of her pain, because then they can be able to move on. They splint her, take care of her pain, and go off to the higher priority patients.
And in your mind, if you're watching this, where does this patient fit into your treatment algorithm? She's conscious, she's got a fracture, no real significant mechanism except to her arm, probably no life threat as far as you can see her that's been portrayed. And you've got 4 other patients at least that are critical, so how much attention do you give her? Fran's going to try to get you to give a lot more attention, which is intended, and which would be probably a bad choice.
Another teaching point is, if you notice, as they're treating a patient, they take out a piece of equipment, they treat the patient, and then they not just have to put that piece of equipment back, but they have to put it back exactly where it should be, because the next time they think about needing that stylet or needing that laryngoscope, it has to be in the exact same place. How many times have you been at a call where you don't find the laryngoscope for an hour after the call because you set it down somewhere. And the reality is here, you use it on one part of the scene, then you have to go over in the other part of the scene. So if you're not conditioning yourself to give care, use equipment, put it back in exact location, you're just not going to have it. And that all counts to not having extra points. You know, we talked about capillary refill in one of the other scenarios. It's critically important that you, every time you make contact with a patient, when you check that pulse, reach down and do a capillary refill to see if that person's going into shock. Several people missed capillary refill. Several people missed checking pupillary response. And, you know, without the brain working, you've got nothing in the CPU of the computer working.
Okay.
There may be some question in your mind as to why would we have rescuers without, you know, the full PPE so close to a helicopter with all the hazards after a downed helicopter. It's our limitation of simulation. So we held them back initially until we could secure the scene. We have some firefighters there, and so, you know, don't.
Yeah, we just mandate regular PPE. We don't, you know, gloves and glasses and things like that. But obviously, at a major scene like this, they'd be pulling those patients over to a collection area away from that hazard.
We actually don't give them an ambulance transport to the 13-minute mark, and so they would ordinarily have had somebody on a stretcher and on the way to the hospital long before this, but we haven't made that available to them.
I know you are.
Yeah, I think the other interesting thing is there's 26 teams here, but there's no animosity. The top 4 teams get selected. The number 4 team is asked to be the run-through team. The other 3 teams end up as, you know they're going to win first, second, or third place, and it's just fun to watch them. And the other teams, the other 23 teams, come and watch them. And these teams become friends. They visit each other's systems. They communicate by email. So it's not just about winning in the JEMS games. It's about participating. And we have a team from the National Intercollegiate Foundation. They come every year. They don't expect that they're going to win because they know that they're not training as much as these other teams, but they just love to go through the course. And we'll spend some other time on another segment of JEMS TV talking about the preliminaries, because the preliminaries are really important for you to see as well. There you know everything that's going to happen. Here you know nothing that's going to happen. So they're really 2 different types of competitions. So the cream of the crop, the ones who excel and are time sensitive, usually end up in the finals, and the other teams, God love them, they all come and watch, and they root for their teams because they are just proud to be a JEMS Games team.
Some of the other people on stage that we haven't pointed out to you is the feedback judge and the scoring judge. Every single patient has 2 people assigned that are part of the staff. One is to give feedback on things the mannequin can't portray. And then the other one is actually scoring based on what the team does or receives from the patient. And that's very well orchestrated. It starts hours and hours before the event, live in the auditorium, and then it's actually built months in advance via conference calls and a lot of work from folks behind the scenes to pull this off. So it's all coming down to these 3 20-minute segments.
And even the sheets have to be, I'll rattle off a couple here, but they have to be sequential so that when you see patient number 1 with a thoracic injury and some burns, you know, assessing level of consciousness, determining Glasgow Coma Scale, assessing airway patency, assessing respiratory rate and effort, assessing pulse, it all pretty much goes sequentially down. Now here at the end, we're going to have the team go down. They're going to accumulate all of their information at the 17-minute mark, and then they're given 1 minute to gather that information, and we'll listen to the scene report here, because I think this is one of the important parts of coming to the JEMS games, not just participating, but coming to watch the JEMS games.
So for everybody out there that's an EMTB or paramedic, you're trying to put together that radar report to try to make heads or tails of what's happened at your scene, and so that the hospital can get that visual picture in their mind of what the mechanism of injury is and the number of patients, the acuity, and what you've done for them and where they're going to go. So let's listen to what he has to say.
Yeah, and as I watch it, it's reminiscent of Dancing with the Stars when these people are out there doing their scenario, and at the end they're huffing, they're puffing, they're breathing, and you could see the same thing here. They've worked really hard for 20 minutes.
Head, pelvis.
The open pelvis fracture. Ivy was on board.
Vitals.
Blood pressure was, heart rate was 128. Blood pressure, I can't remember.
Okay, that's fine.
Please give a report.
I got you. Just to you or who? To the hospital. Hospitals, Cumberland County, en route to your facility, or we had, I guess we're en route. 1, 2, 3, 4,
5 patients. First patient was a burn patient, male, 30 years of age, unable to obtain an airway for him. He eventually passed away at the scene. The other one was a baby, had occipital injury of the head. Initially, respirations were 60. They began lowering, suction, intubated. After intubation, vital signs returned to normal. Eyes were pinpoint. Had a 32-year-old male, had a head injury on the left side, a pelvis injury. Vitals were initially 128 by pulse rate, respiratory rate of 32, had an IV established O2. Also had a firefighter down, possibly an allergic reaction. Was given epi, Benadryl, went into cardiac arrest. Also had a female patient, bystander, had an abrasion to the arm, was given pain medication, wound was bandaged, had good pulses in her arm. And that's all we had.
Time. Thank you.